The short answer is yes. I believe rehabilitation is a key strategy to reduce the impact of COVID-19, especially on the health and function of people. Well, for someone who's had a severe COVID infection, there are multiple phases of care, and rehabilitation should be included in each phase. For example, in the acute phase, which may be when the patient is in the ICU or the critical care unit, rehabilitation should be a part of that phase, of treatment in that phase. In the subacute phase, which would be in a ward of an acute hospital or perhaps in a step-down care like region rehab, rehabilitation is an integral part of their treatment. And then of course there is the phase where the patient has been discharged and is at home. Even though they are at home, they are still recovering, and rehabilitation is important in that sort of long-term phase of care as well. Well, after a COVID infection, patients experience a variety of problems with normal functioning, which is your day-to-day functioning. So at Region, we believe it's important to have a simple screening process, and that's what we do. A lot of patients are not able to undergo a complex process of screening them or evaluating them. We also have a multidisciplinary team approach, so the patients are managed by doctors, nurses, therapists. We also have a psychologist on board to provide patients with psychosocial support. There are also 4 evidence-based classes of intervention, which include exercise, practice, psychosocial support, and education. And a very important part of education is teaching a patient self-management. And so we practice this at Region Rehab, and besides this, we also have programs that are tailored specifically to each patient based on their individual problems or impairments. Is it necessary for all categories? Probably not. Many patients, especially in the category 1, are asymptomatic. Many of us may have had COVID and not even know it. But the more severe the disease, the more important rehabilitation is to get you back to where you were.